Well, we've all heard of eye jobs and nose jobs, but there's one job that doesn't get all that much attention: cheek jobs.
There's lots of things we can do to cheeks. And you think about it, when we're younger, we had round, full faces, but as we get older, we lose fat and volume in our faces. And that's where fillers can help augment your cheeks. Other people will do cheek implants. Another option is fat grafting.
Back in the day, when I started my training, we were doing a lot of cheek implants. Okay, lots can go wrong with that. They can get infected, you can have problems with the bone, they can migrate. So, I mean, I haven't put a cheek implant in years and years and years. The mainstay for higher cheeks is either fillers or fat grafting. I do both. If you're in the OR getting a facelift, I tend to drift towards fat grafting, a little more permanent result. If you're just looking for some quick, subtle improvement, fillers are great. My go-to is Voluma for the cheeks. It lasts up to 2 years. It's a great filler, easy to inject, and you actually leave the office, wham, bam, I got nice cheekbones.
There's a lot of fillers that have a high G prime, they're very thick, that can be placed in that area to help. We always deflate around this part of our face, so definitely that's one way. A more permanent option would be a cheek implant. They can be placed, they can give you that volume. It's an option.
I really would caution someone against an implant unless they had maybe a facial fracture or something else where they actually had a really bad deformity of their cheeks. But even then, you know, the fillers are so quick and easy with so few complications. That's my go-to.